For us, what we did was one to use a combination of both AI and drones. And so you're able to use drones in terms of figuring out what are the mosquito breeding sites across the different communities, using a bit of AI for prediction and modeling. And then based off that, we're also using drones for spraying as well. And so in many ways that reduced, the malaria cases that we'd be able to get. The second part was where you have our community health workers being the frontline workers for primary health care. 70% of the cases they deal with on a yearly basis are malaria cases. And so if you're empowering them with these decision support tools that help with better diagnosis, better prediction, then I think we're able to see how AI along the entire pyramid of care can be used to sort of, not just from a prevention perspective, but also to treat and lower these cases and lower the number of deaths that you could see across the board. But coming back to your question, and I mentioned it earlier, for us, technology is central to everything that we do. And so the point that was being made earlier, figuring out the problems, for us it was knowing what are the biggest pain points in healthcare. If diagnostics is one of them, where do we use AI and other emerging technologies to solve for that? The other one was around demand forecasting for health commodities, because you would have stockouts and then slow procurement processes. Eventually the prices become high and very unaffordable for our patients. And so the idea was, how do we use AI-enabled market intelligence to better do demand forecasting for these health commodities and make sure that we're reducing on the stockouts that we're having. Bill talked about maternal health care, where we're using AI-enabled ultrasounds to support that. And so what you're seeing is that there's less referrals that are happening across the board. So we've done a similar exercise even in agriculture, in education, to say, what are the pain points we're all trying to deal with from a policy standpoint as a national government, and do we see an opportunity for AI and other emerging technologies to help solve for that? And then we're able to work with various partners to co-design what kind of solutions can help to do that. And so, to your point, today, when I see the Ministry of Health as an example, because the conversation is in health, they're very much our digital ambassadors, because everything they're doing, they're data-led, evidence-based. They're making sure that they're leveraging technology for all the interventions, and that's what we want to do to make sure that it's mainstreamed across the different sectors.
I mean, it really